Good day, students! Heads up! We'll be learning new stuff for today, the postpartum physical assessment. But first of all, I'm going to introduce myself to each and every one of you. My name is Sabra of BSN 2-1, and I will be your guide through Nursing 107, the care of mother, child, and adolescent. So what time is it? It's time for learning! But what is postpartum? It is the time immediately after the birth of a child that extends for about 6 weeks, and in which the mother's baby, including the hormone level and uterus size, returns to non-pregnant state. The goal of postpartum care is to assist and support the woman's recovery, educate mother about her own self-care and newborn feeding and care, promote bonding between newborn and the family. The danger in the immediate postpartum are hemorrhage, hypovolemic shock, and infection. For the first 24 hours after birth, all postpartum women should have regular assessment of vaginal bleeding, uterine contraction, fundal height, temperature, and heart rate. Blood pressure should be measured shortly after birth. The purpose is to fully assess a postpartum mother, thereby preventing complication after delivery. The materials needed for this is bed, pillow, linen, blood pressure apparatus, thermometer, top linen, stethoscope, and gloves. The assessment for these are the following: client's level of consciousness, method and date of delivery, number of postpartum days, and vital signs of the mother. To begin this procedure, we must first take these considerations. First, identify the client. Second, introduce yourself. Third, provide privacy. Fourth is to document each procedure and its finding. And fifth is communicate with a smile. And most importantly is to do the hand hygiene. For the maternal assessment, first, the breast assessment. Place the client in the supine or sitting position. Open for the gown and expose the breast to be examined and inspect for the following: consistency, nipple type and integrity, swelling, redness, engorgement, and tenderness. For the uterine assessment, expose the client's abdomen and assess the tone, height, and location of the fundus. For the bowel assessment, ask the client whether she moves her bowel or not, whether the flatus is positive or not. Auscultate for bowel sounds and assess for abdominal distension. To promote optimal bladder function after giving birth, we encourage patients to have the urge to go to the bathroom. After passing the urine of the client for about 15 minutes, this is the perfect time to do the bladder assessment. Ask the client for the widening pattern, presence of pain, or burning sensation during urination. Palpate for the bladder distension and check the fluid balance, intake, or output. For the lochia assessment, assess the amount of lochia and note the time of the last perineal pad change. Saturation of one pad in less than an hour or constant retrical of lochia or presence of large blood clot is indicating of more serious complication that should be addressed immediately. Assess the numbers of days that the woman has delivered the baby and identify the type of lochia or the vaginal bleeding. The type of lochia, first is the lochia ruba. 1 to 3 days after delivering of baby, the color of this is red. Lochia serosa, 4 to 10 days after delivering the baby, the color of this is pink. And last is the lochia alba, 11 to 21 days after delivering of baby, the color of this is yellow to white. For the assessment of episiotomy, let us first define what is episiotomy versus episiotomy. Episiotomy, it is the incision made in the perineum, and in episiotomy, it is the surgical repair by suturing. For this assessment, we are using the acronym REDA, or the redness, edema, ecchymosis, discharge, and approximation. Redness is considered normal with episiotomies and laceration. However, in the significant pain presence, further assessment is necessary. Use ice pack for this. There should be an absence of discharges from the episiotomy or laceration, and then the wound edge should be well approximate. Perform Kegel exercise as soon as it's comfortable to do so. Next assessment is the human sign test. It is also called the dorsiflexion sign test. It is a physical examination procedure that is used to deep vein thrombosis. A positive human sign test, presence of the clinical sign, may be a quick indicator of the deep vein thrombosis. The emotional status and bonding. Emotions are the essential element of the postpartum assessment. Postpartum women typically exhibit symptoms of baby blues or postpartum blues. The postpartum blues are caused by a multitude factor including hormonal fluctuations, physical exhaustion, and maternal role adjustment. After the emotional status, there is the bonding, or sometimes referred to as the attachment between mothers and the infant. And these are the positive attachment including touching, holding, kissing, cuddling, talking and singing, and expressing pride in the infant. And that's it! As we venture the learning of postpartum physical assessment, I hope to give you a clear knowledge that can help you achieve that RN. Again, my name is Sabra of BSN 2-1. Goodbye and see you on the next adventure.